Statistics say that every one diabetic has on average 2.5 incidents of low blood sugars each year. Hypoglycemia is the medical term for low blood sugars, so you may hear that a lot. But don't feel like hypoglycemia is an actual part of having diabetes. I haven't had any hypoglycemia since the second year I was diagnosed. So getting good blood sugar control is really your best bet for prevention of hypoglycemia. Different individuals have different factors, and everybody's risk for hypoglycemia will vary based on the factors. This webinar is focusing on the recognition, treatment, and planning and social network support for people that have low blood sugar incidents. In this webinar, you're going to learn the categories of people at risk for low blood sugar, the physical and cognitive symptoms, basic treatment guidelines, a tip list for emergency planning, and a guide for building a social network. Hypoglycemia is defined by a low blood sugar less than 55. Treatment for hypoglycemia begins at a blood sugar of 70 for most people. However, there are categories of people that may need to pay attention to a higher threshold for treatment. Maybe around 80, maybe that's 90 or 100. The categories with a higher threshold include those listed here. There can also be a higher threshold if somebody is treating preemptively for hypoglycemia that is going to occur in the future. This may happen if somebody sees a blood sugar trend that is fast and downwards, and there's a reasonable expectation that the blood sugar will continue to decrease. Those situations may be, for example, when insulin is given or if there is exercise going on. The symptoms of mild hypoglycemia are the first alert that the body is in the state of a sugar deficiency. These symptoms may include the following in the chart. If mild symptoms are not recognized, then a person may experience severe symptoms. Severe symptoms are as follows in the chart. The most severe of hypoglycemia symptoms are loss of consciousness, convulsions, and the inability to swallow. An easier way to classify and remember all of these symptoms is to divide them among symptoms of the physical body and symptoms of the brain. The medical terms are the autonomic nervous system and the neurological system. The physical body signs and symptoms are similar to that of a panic attack. Symptoms include sweating, shaking, fast beating heart, dizziness. The symptoms of the brain are anger and irritability, clumsiness, muscle weakness, confusion, or maybe just appearing dazed, sleepiness. It is interesting that some people will have different presentations of low blood sugar. There's theory that low blood sugar affects different areas of the brain for different people. An example of different presentations are my low blood sugar versus my grandpa's low blood sugar, who was also type 1. When my grandpa had low blood sugar, he would start to drive really fast, and otherwise, he was very slow at driving. When my blood sugar is low, I drive fine. You may notice that I just stop talking, and I actually become very focused on whatever it is I'm working on. If I look really close, I may see my index finger shaking. It's important to note that a person may experience low blood sugar symptoms at different levels. For example, my grandpa usually didn't experience them until he was at least 30. I'll usually experience blood sugar lows around 45 to 50. Kind of depends on what the blood sugars have been in the last few weeks, too. An extremely important point to keep in mind if you're going to drink alcohol and you have diabetes, and that is that the brain symptoms will mimic that of being drunk. So it's actually much more dangerous to drink alcohol with diabetes, and never just assume that the behavior is the alcohol. And this is where it's important that your friends or the people that you're around know that you have diabetes, and they should know not to assume that any uncanny behavior is the alcohol, because it could be a low blood sugar. The treatment of hypoglycemia follows the rule of 15s. This is a foundational protocol to commit to memory. If there is hypoglycemia in you or your loved one, then 15 grams of quick-acting, fast-acting carbohydrate will be eaten. You will wait 15 minutes to check the blood sugar again. If it has not raised to proper levels, you will again eat 15 grams of carbohydrate. You will recheck again in 15 minutes. If the blood sugar is not where it should be, then you call for help. There's also a caveat to the rule of 15, because actually the glucose needs can vary based on the measurement of the blood sugar and a person's weight. So here's the chart for that for your reference. Now let's review the treatment. First, I'm going to discuss treatment for severe symptoms, like if someone was too confused to swallow or if somebody was passed out. You never put anything into the mouth because the person could choke. The correct actions to take are turn the person on their side, lift the chin in the airway, inject glucagon if it's available, call 911. If glucagon is injected, then when the person wakes back up, they can expect possibly some vomit. So that's why they're on their side. If you find yourself in the situation that there's not a meter around, but you're having symptoms of low blood sugar, then you should always treat and not delay. Oftentimes I get the question about what foods and sugars are best for low blood sugar treatment. Here are the best options: liquid dextrose, glucose gel packs, glucose tablets. The liquid dextrose is the fastest, followed by the gel, and then the glucose tablets. These are all options bought at the stores that are usually found by the pharmacy counter. The carbohydrates are on the label on the back, but for your reference, a bottle of dextrose and a glucogel pack are about 15 carbs. The glucose tablets are 4 carbs, so 4 tablets will be 16 carbs. It is important to know that dextrose is quicker than glucose is quicker than fructose, and fructose is faster than sucrose. Many people do not realize that sugar comes in all different forms, and that some are faster than others, so committing this to memory is important. If you are looking to carry real candy options, then I would suggest ones that are easy to carry and fast-acting dextrose. Airheads are dextrose, and they're about 9 carbs for one of those small packs. Smarties are glucose and dextrose, and 1 pack is 6 grams of carbs. Pixie sticks are mostly glucose, but they are 3 grams of carbs per stick, and they absorb very quickly. Jelly beans are kind of an old-time favorite, and each jelly bean is about 3 carbs. Some people want to choose foods instead of the actual things designed from over the counter, like the liquid dextrose and the glucose tablets. I would only recommend that you use foods if your blood sugar is not less than 60 and if you're not dropping too quickly. And if you want to choose foods, then you should choose some that are high on the glycemic index over 80. To start, every person with diabetes should build an emergency toolkit, and I would build 3 toolkits: 1 for work, 1 for the car, 1 for home, or if you go to school, then 1 for school. This toolkit should include glucose tablets or the candy with a minimum of 15 grams of carbs. Preferably, there should be 30 carbs. They'll also include glucagon, an injection to raise blood sugar, a glucose meter, and emergency contact information. Glucagon is only available by prescription, and you may ask your provider if it is appropriate for your situation. Building a social network is also a safety net that you should put in place. The safety net includes people you live with, go to school with, work with, socialize with, maybe go to church with. They should all know the signs of diabetes and even how to recognize your individual signs of low blood sugar, as we mentioned. You will be their educator, just like all the other times that you've had to educate people on diabetes. But the person that you should educate the most and be the most highly trained is the person that you're going to live with. And if you live alone, then I recommend a medical alert system available at your home as some form of support. If you have a glucagon prescription, then the person you live with or the person who's most likely to be there with a low blood sugar for you, that person needs to be trained on how to inject glucagon. It's not very easy if you're getting the old school ones where you have to pull it up from a vial. There's actually an app that you can download on your smartphone to teach you this. But the point is that if you're unconscious, then it's the other person who's going to save you. There has actually been studies to show that as many as 6 times out of 10, the other person chose insulin instead of glucagon to rescue their loved one. It is also not uncommon that a person may feel like they don't want to tell their work for fear of losing the job or seeming out of control or having a vulnerability. Perhaps a person doesn't want to tell friends because of stigma. Maybe this is you. If so, diabetes counseling and coaching can help you. It's very important to create emergency plans, travel plans, exercise plans, diet plans, or dealing with a work schedule, and to find the correct routine and setup so that your diabetes management is safe and without any incidents of low blood sugar. Thank you for watching this webinar.